Good evening again, everyone. Uh, uh, I switch gears with that uh, because this series will push your emotions and not in a good way. So I'm changing gears, and this is self care, the formal, pharmacological series, because there's a lot of things with self care you need to understand. Uh, the Lord is my strength, and the Lord is my strength and shield. I trust Him with all my heart. This is the book of Psalms, chapter 28, verse 7. So, this may be a little confusing to some people, but hang in there. Uh, it will help you all a lot. So, okay, all right. The DSM-IV is a comprehensive manual published by the American Psychiatric Association in 1994, used to diagnose and classify mental disorders. It provides standardized criteria for mental health professionals to identify psychological conditions. What it is a diagnostic tool for mental disorders, includes specific criteria for each disorder, uses a multi-actual system to access individuals across 5 dimensions. The first is Axis 1, clinical disorders. Axis 2, personality disorders and intellectual disorders. Axis 3, medical conditions. See, it had everything in it, and you can look up, look up these things, including medical conditions if you're not sure. Ac- Axis 4, psychosocial environmental factors. Axis 5, global assessment of functioning, GAF score. Where this is used primarily in the United States, adopted by clinicians, researchers, and institutions worldwide, applied in hospitals, clinics, academic settings, and legal systems. Also, people use it at home. I do. When published, it was published first in 1994. DSM-IV or Tiara text revision. It was revised in 1994. Released in 2000 with updated text, but no major structural changes. Replaced by DSM-5 in 2013. Why? To create a uniform language for diagnosing mental disorders, to improve diagnostic reliability and validity, to support research, treatment planning, and insurance coding, to move away from psychoanalytic theory toward a more empirical descriptive approach. Who uses this? Developed by American Psychiatric Association and used by psychiatrists, psychologists, social workers, researchers, insurance providers, legal professionals, and everyday people. Clinicians, this was implemented by clinicians to use structured interview to help them with it, and assessments to match symptoms with DSM criteria, multi-axis format encourages holistic evaluation of mental, physical, and social factors, widely integrated into training programs, clinical practice, and policy frameworks. In summary, DSM-IV was a landmark in psychiatric diagnosis, offering a systematic and research-based classification of mental disorders. Its multi-axis system allowed for a nuanced understanding of patients, considering both psychological and contextual factors. It laid the groundwork for more refined diagnostic tools in DSM-5. Okay, in conclusion, DSM-4 helped standardize mental health diagnosis across disciplines and borders. While it had limitations such as cultural bias and rigid categories, it was a critical step forward in evidence based psychiatry. Its influence persists in clinical practice and mental health education. In my opinion, DSM 4 was a necessary evolution in mental health care. It brought clarity and consistency, but also sparked debates. Debates are good about m- medicalization, overdiagnosis, and cultural sensitivity. Amen to that. Its legacy is mixed, but undeniably foundational. It reminds us that mental health diagnosis is both a science and a art, holistic holistic, requiring constant refinement. Yes. So I hope it wasn't too spiritual. Now, this, I think that everyone should have this book at home. It helps you to understand a lot, especially if your family or someone you know are diagnosed with something. You can look at this. Also, you can Google it too. I don't know if it's maybe it's in Google, but anyway, this book. And the latest is DSM-5. You can get it on Amazon, bookstore, or whatever. If you're curious about something you heard, look it up. So I hope I didn't confuse anyone. So take care of yourself and each other, and hope you had a good day. And please share, like, and subscribe if you're not a subscriber already. And I say namaste. And please pass this on. Thank you.